Here we go for the next one. This is heart and blood vessels too. Okay. All right, fill in the blanks. The rhythmic expansion and recoil of an arterial wall can be felt as a pulse. Okay, normally the should be pulse rate equals the heart rate because the arterial walls pulse whenever the ventricle contracts. Okay. All right. Blood pressure is the pressure of blood against the wall of the blood vessel. That's how that's measured. A sphygmomanometer can be used to measure blood pressure at the brachial artery. Sphygmomanometer. That always reminds me of Snuffleupagus from the old Sesame Street. A sphygmom. Okay. Say that 10 times faster, Daria. Okay, so this is about systolic and diastolic blood pressure. Systolic is reached during ejection of blood from the heart, or another way you can think about this is kind of left ventricle contracting. It's contracting to expel the blood out of the heart. And the diastolic pressure occurs when the left ventricle is relaxing. So the blood has been expelled and now it's going to relax. Okay, high blood pressure is called hypertension, H-Y. Notice that prefix, hyper, above, more, over, okay. Low blood pressure is hypotension, below, less, under. Greek and Latin roots in science and especially in medicine, so helpful, so helpful. Okay, so if you're told that your blood pressure is 120 over 80, then the 120 is your systolic blood pressure when the ventricle is contracting to expel the blood. And the 80 is your diastolic when that ventricle has relaxed. Okay. So this is showing a sphygmomanometer right here, and the reading it's taken for the systolic and diastolic pressures. There are some offices that still take blood pressure this way. It has the blood pressure cuff and then like a stethoscope that kind of slides underneath so that you can hear it in the stethoscope, through the stethoscope. When you first start hearing it, the pulse, and then when you can't hear it anymore, you take those measurements. Otherwise, we have blood pressure machines that are automated that do it for us. Okay. Actually, I remember one time I went to the doctor and I knew my blood pressure was really low, and it was. And the nurse was trying to get a reading and she couldn't. I wasn't that low. I'm like, I'm not dead, obviously, I'm here. But anyway, and then she was trying on the automated one and they couldn't get it. And I remember my doctor coming in and he was like, here, just move. I'll do it. I'll get it. I'll just go ahead and move. And he did, because he was awesome. But it was kind of funny because she's like looking at me like, Clearly your blood pressure isn't low enough to be dead. No, but it's low enough the machine's having a hard time. Anyway, I digress. I just remember that being funny because my doctor, just move, just get out of the way. I'll just do it. He did it on the sphygmomanometer, used that one. All right, so blood pressure. We've talked about this some in the last lecture. So blood pressure is going to be highest at the arteries, which we know. Okay. And then we know that it's going to be slowly decreasing in pressure as the blood flows from the arteries to the arterioles to the capillaries, and then even lower in the veins and venules. We also talked about blood velocity, the force at which it's being sent out into the vessels. So blood velocity is obviously also going to be highest at the arteries, because they're the first blood vessel to take in the blood as the heart pumps it out. We also know that this is going to decrease as it goes because the tiny blood vessels aren't going to be able to handle that velocity. So its velocity is also going to decrease as it moves through the system. However, interestingly enough, after it gets through the capillaries, the velocity will increase slightly after. Increases a little after that. So when it hits the venules and then the veins, the velocity is going to increase a little bit. Not a ton. Okay. So again, we have to have the lowest velocity here and the lowest pressure, not only to protect the capillaries and keep them from blowing out because of the velocity and the pressure, but also so that the exchange can happen between nutrients and wastes. A simple way to think about that, or the second part, is imagine being on a truck, a delivery truck, and going 60 miles an hour down the street past your destination. And as you go past the destination, you just hurl everything out at 60 miles an hour. It's got to slow down. You've got to slow down, right, so that you can do that. So same thing's happening with blood. All right, the cross-sectional area of the vessels. This is where we're going to have our arterioles diverge into capillaries. Actually, hang on a second. I'm just enjoying apparently spelling things however I want at the moment. Better. So when the arterioles are diverging into capillaries, it's kind of like a freeway interchange. There's a lot of room for this exchange to take place. right. Can I just tell you that, move this around. You know, all the memes about like opening your phone and finding that the camera is facing you and how terrifying that is to see yourself at that angle. Guys, it's got nothing on Zoom meetings, because if I go back and I watch them, or if I edit something, all I can think of is, oh my gosh, do I really look like that? Do I really sound like that? It's like worse than opening the camera to the front view. That's all I can say. It's not good for your feel goods about yourself. It's another great benefit from COVID is nothing but Zoom. Okay, capillary exchange. In other words, we're going to start talking about how and where nutrients and wastes, oxygen and carbon dioxide, fluids, where that kind of transfer is going to happen. Because even though capillaries are crazy tiny, they do have ends. They have an arterial end and a venular end. Okay. Pressure and velocity of blood is very low in the capillaries to allow exchange of oxygen and nutrients. From the blood to the cells. So the oxygen and nutrients are coming out of the blood and being dropped off, and the cells are in the tissues for cellular respiration and all the other life processes and all the other protein building and everything else that cells do to keep us alive. And then we have the reverse when it comes from the cells to the blood. We're going to have our carbon dioxide and our wastes. Okay. Two forces move fluid through the capillary walls. We have our blood pressure generally causes fluid to move from the capillaries to the tissues. Okay, so it's out of the capillaries, out of the blood and into the tissues. And again, this is kind of a repeat of what we just wrote, but we've got oxygen and nutrients. And then guys, we have something called osmotic pressure. I've done Garfield. Yeah, I did Garfield with you. Put it on your exam, I think, too, as extra credit. Garfield's wrong. No, wait, I didn't. That was my other class. Did I give you guys Garfield? I don't remember. I gotta show you, in case I didn't. You guys remember what osmosis is? Osmosis is water moving through a semi-permeable membrane. It is a passive transport process. It's diffusion. And I don't know about you guys, if any of you are close to my age, you probably had this poster hanging up in your elementary school classroom, middle school, heck, even high school, because Garfield, he's the man. I still love Garfield, not gonna lie, maybe it's a ginger thing, don't know. But I'm learning by osmosis. Garfield has it wrong. I wish that we could absorb information, that it would diffuse into us like he's showing. But osmosis is only referring to the passage of water. So maybe Garfield said I'm learning by diffusion. Doesn't sound as exciting, but still would have been a little bit more accurate than osmosis. Bye, Garfield, America's favorite fat cat. Yes, you are. Always. All right, so going back to that then, the whole point I brought all of that up was to talk about osmotic pressure. That osmotic pressure is referring to the distribution of water, the concentration gradient that is created depending on where the water is. Okay. And the osmotic pressure is going to cause the opposite. I know that my stuff is gone that I wrote up here, but the osmotic pressure is going to generally cause the carbon dioxide and waste to move from the cells into the capillaries. So you've got your blood pressure, which is the good stuff in, and you have your osmotic pressure, which brings the bad stuff, the wastes, out. Okay, so at the arterial end of the capillaries, our blood pressure is going to be higher than the osmotic pressure. This makes sense for a couple reasons. First, we are coming out of the arterioles, which came from the arteries, which came directly from the heart. So we're still going to have some of that lingering force, velocity, be slightly higher at the arterial end. And the osmotic pressure, like I said, is going to be lower. The other reason that this makes sense is because we know that from the arterial end, we have oxygenated blood. And this is where we've got to send the good stuff in, okay? So it makes sense that our blood pressure would be higher at the capillaries. So this is going to essentially, we're going to have our oxygen and nutrients are going to be pulled out of the capillary into the cell. This is a diffusion, again, type process. At the venule end of the capillaries, we have the opposite, which again is going to make sense. The osmotic pressure is going to be higher here than the blood pressure. And that's because we're going to have our CO2 and wastes pulled back into the blood. So pulled into the capillaries. Let's go up here. Let me fill this out before I talk about this last point. We've got higher blood pressure up here at the arterial end. And our osmotic pressure is low. Our oxygen and nutrients are pulled into cells because of this higher pressure. That's that one. Then we have low blood pressure, high osmotic pressure. The high osmotic pressure is going to draw the wastes in. And up here is our arterial end, and here's our venule end. That was fun. Okay. Fluid movement in and out of the capillary should be equal to maintain fluid balance. So this is like a dynamic equilibrium we've talked about with tonicity, and that water follows the solute. So we want to have an equal exchange of fluids. So there's as much water flowing into the capillaries as there is flowing out to keep everything nice and balanced. Okay. Okay, movement of blood through the veins. I told you in the last one that we would kind of go over some of the processes since there's not a pump to send the blood back to the heart. We're going to talk about the mechanisms that allow the blood to get back up there without a pump. Okay. Already talked a little bit about the venous valves. These prevent backflow of blood. This is actually also called retrograde flow. Okay. And then, oh, varicose veins. Varicose veins, you guys. That's what I was trying to think of. And I couldn't. Spider veins. Varicose veins. There you go. Okay, so the next thing we have, which is actually being shown here in these images, is something called the skeletal muscle pump. And essentially what that is that anytime we move our bodies, the skeletal muscle contracts around veins. And as it does, it forces the blood up through the veins back to the heart. Okay. So it would kind of be like if you have your garden hose and there's water in it, but there's no pump to make the water come out. But if you kind of squeeze the garden hose on the side, it's going to push water out. That's what skeletal muscle pump is doing. Propels the blood upward. That's a P. The respiratory pump. This is actually a pressure thing as far as like a vacuum type thing. It's because when you inhale, inhale the volume, speaking of like the gas volume that you breathe in, is going to increase in your thoracic cavity. Okay, right. So if you're just sitting there right now, take a deep breath. You've just increased the volume of gas in this thoracic cavity. When you do that, it causes a low pressure environment. Equals higher and that equals low pressure. This has an inverse relationship. So when we exhale, the opposite's going to happen. When we exhale, obviously you're decreasing the volume of gas in the thoracic cavity. And the pressure changes. And this is going to draw blood up, like sucking something through a straw. Okay, so it has that same sucking type result. I know not all of my explanations are lovely and scientific, but practical application is what helps you remember. I was going to tell you something about this. What was I going to tell you? Oh, skeletal muscle pump. So one of the reasons that you could have an increased risk of like a blood clot or something like that if you've been sitting for hours at a time, like on very long drives, long flights. Some of it has to do with the skeletal muscle pump thing. If you're not moving some of those larger muscles to push the blood back up through the veins. You can increase the likelihood, pregnant women especially. Yeah, okay. So blood pressure effects on the body. We already know that high blood pressure is called hypertension. Hypertension weakens the arteries, and it can cause artery rupture. One of the other things that it can do, it can also cause arteries to harden. So it can weaken them, but can also cause them to harden, meaning that they've lost a lot of their elasticity. Something that's too rigid with that much pressure and velocity can rupture from that as well. Okay, so then we have enlargement of the heart. This is where the heart is pumping harder in an attempt to get the blood through the vessels. So it's just not pumping efficiently. So it kind of just gets bigger to try to be like put more muscle behind it. Maybe then it can get all the blood through. Okay, so an enlarged heart. Kidney failure. Kidney failure can be caused when the arteries have hardened, which again we know means that they've lost a lot of the elasticity, but it also means that they've lost a lot of their ability to filter out blood, okay? And so the kidneys have to work a lot harder to be able to do that. Sorry, it's all running together. Equals kidneys work harder. Question of the day, do energy drinks affect your blood pressure? They have been shown to increase blood pressure, and there's a number of articles that talk about some of the reasons behind that, including the amount of stuff that's dissolved in these drinks, which has a variety of effects in making several different body systems work harder. Okay, cardiovascular disorders. So we've got something called atherosclerosis, plaques in the blood vessels, often caused by dietary issues, diets that are higher in saturated fats and cholesterols. We talked about how plaque in the arteries can increase blood pressure because it decreases the amount of room the blood has to flow. Same volume, smaller area, blood pressure goes up. So increases blood pressure, and this can lead to artery rupture. Or the arteries can become brittle. Arteries and rupture. Stroke. A stroke is when an arteriole in the brain or in the cranium bursts or becomes blocked, and a portion of the brain dies because of lack of oxygen. So it's like the blood is being pumped, you're breathing, your heart's working, but because of a blockage or a rupture, the blood isn't getting to all of the brain. And so the cells start to die, and then larger parts of the brain start to die. So it can lead to paralysis or death. This does depend on how bad it is, where it is, and how long it is left without being resolved. Myocardial infarction or a heart attack, blocked coronary arteries. The same thing that happens to the brain in a stroke is what happens to a heart in a heart attack. Part of the heart tissue dies because of lack of oxygen. Okay. Then we have an aneurysm. Aneurysms are weakening of the arterial walls, usually due to high blood pressures or plaques. There are other things that can cause aneurysms, however. These are just some of the more common ones. Vessels can rupture and bleed internally. Talks about wall balloons. This is essentially where if there's a section of the artery that has become weak, you can place a balloon up through it that can expand it again, kind of keep it from collapsing in on itself. As far as some of the treatments, but at the same time, you know what? I bet that's not what she meant when she put this. She isn't talking about the treatment yet. She's saying that the aneurysm is like a ballooning of the arterial wall. Okay, treatment. When plaques dislodge, you can end up with blood clots. Blood clots can be dissolved chemically. Sometimes they'll put you on blood thinners to try to keep that from getting bigger, sometimes to help dissolve it, and just to keep the blood moving through all the different organs and all the different vessels without that clot getting caught. Bypass surgery is another possible treatment for some of these issues. This basically involves taking what's the easiest way to put it? You basically take a portion of an artery from some other part of the body, and then you use that to literally bypass the coronary artery. So it's not that you necessarily go and clear out that plugged artery. You're just kind of creating an alternate way for the blood to go, to get around the blockage. So kind of like cars that are having to take a detour to get around a traffic jam. That's what a bypass surgery is doing. And you can have up to 4, which would be a quadruple bypass if all of those arteries are blocked. Okay, angioplasty. This is what I thought she was going with the aneurysm. But angioplasty is a small balloon that's inserted into a clogged artery, and it's inflated, and so it forces that blood vessel to open up again to let the blood flow go through. Normally with these though, the balloon opens it up more to its normal size, or the size it should be, but in order to keep it there, it has to have a stent placed after. So it's opened up using this balloon that gets inflated, and then a stent is placed and the balloon is deflated and pulled back out, and it keeps the vessel open like it's supposed to be. there we go. We have finished the heart. Congratulations, we're almost through the lectures for this week. So I will see you soon.